Good afternoon, everyone, and welcome to the Memphis and Shelby County Joint COVID Task Force update. Today, as always, I'll give some data updates, but I also want to highlight some new guidance that's come out specifically about schools as well as around isolation and quarantine. Then we have two guests with us today. We have Jenny Bartlett-Prescott, who's going to give an update on testing. And then we have Dorcas Young-Griffin, who's going to give an update on services and supports that are available to our community members that have been impacted by COVID. And then we'll open it up for questions and answers as we always do. As of today, we have 25,364 cases. I'm pleased to announce that's an increase of only 89 since yesterday. Unfortunately, we have had 334 deaths, but that still is about a 1.3% death rate, which is lower than the rest of the country, and that's remained stable throughout the pandemic. And we're very disappointed in any death, but are pleased that our death rate has continued to stay low. Our overall positivity rate for the pandemic is now at about 10.9%. But what's most promising is that we have had a steady decline in our positivity rate week to week since around the 4th of July, when we mandated masking through the health directive, as well as closed limited service restaurants. So we're now down to 13.5% for the past week. We want to get that to well below 10%, and once we get to 10%, we want to look at a 5% positivity rate. This is truly a reflection of our positivity rate and not testing capacity. As you'll hear shortly, we have significant capacity within Shelby County. Our recovery rate is at approximately 84%, so we have over 21,000 people who have recovered to date. And then the other promising news is that our reproductive rate is now below 1 and has been staying below 1 for several weeks, so that's a really promising sign. But what I want to point out is, while all of this is promising, it's really critical that we stay the course. It's difficult when it's beautiful weather outside and the majority of us feel well and see our numbers trending downward, that we want to get back to our normal, or what I'll call our pre-pandemic normal. And we really can't do that currently. We have to continue to stay focused on where we are, and we need to remain vigilant. We're going to be paying very close attention to schools opening and activities and outcomes related to that. And then also, as youth begin to play sports again, we're going to need to pay very close attention to that. So at the current time, we're going to stay the course, and there's a few things I want to highlight that we always highlight. It's really critical that we continue to social distance. I would challenge those of you who might want to go to a football game this Friday to think ahead of time about how you're going to social distance while you're there. Also, how you're going to continue to wear a mask throughout the game. It may mean taking a second mask with you in case your first mask gets wet or damp and therefore is no longer effective. And then also, some of you may need to make sound decisions about whether or not you should even attend an event, particularly sports-like events or other places where there will be significant numbers of people. And as a nurse, I'm always reminding people of the importance of hand washing, so continuing to wash your hands. But if you are attending any particular event, like a sports event this week, then you want to make sure that you have hand sanitizer with you, so that in the event you don't have access to soap and water, you can use hand sanitizer. Lastly, I want to reinforce the importance of protecting our most vulnerable. And in Shelby County, that's anyone over the age of 55, and then individuals with chronic illnesses, particularly heart disease, diabetes, or any respiratory illness. If we continue to do these things, I'm confident that our positivity rate will continue to go down and our transmission will continue to go down in Shelby County.